discussing sexual and reproductive health experiences for young people with autoimmune diseases. My name is Ella. I've lived with juvenile arthritis for 9 years, and I'm a member of Young Patients Autoimmune Research and Empowerment Alliance, or YP Area. YP Area is made up of young patients with autoimmune conditions who are passionate about research. Our mission is to empower young people with autoimmune conditions to access, understand, and have a voice in health research. And our vision is for young people to feel connected, heard, and valued for their unique stories. We utilize events like this one to collaborate with researchers on topics that are important to young patients, to empower young patients to tell their stories and to impact research, and to make research accessible to young patients. Conversations about sexual and reproductive health are already difficult, but having an autoimmune disease complicates these conversations even more. Today, we will hear from experts and young adults about interactions between autoimmune diseases, medication, sexual wellness, birth control, and pregnancy. Then we will share our knowledge, experiences, and resources to help you have these conversations with your healthcare provider. And finally, we'll conclude by discussing decision aids and how they can help you navigate your sexual and reproductive health care. Before we begin, we ask that all participants please stay muted during the event, but please flood the chat with your questions and comments. We have a few of our wonderful YP area members monitoring the chat to make sure everyone is heard. We would also like to remind everyone that this event is recorded and parts of the recording may be used for future promotional materials. However, any health information you voluntarily disclose will not be reshared in any capacity outside this event. So without further ado, let's get started. A majority of today's information was shared by our three amazing experts. The first one being Dr. Rebecca Brenner, a pediatric gastroenterologist and clinical investigator, currently investigating reproductive health among young patients with IBD. Second, we have Dr. Brittany Huynh, a pediatric rheumatologist and adolescent medicine specialist, whose interests include reproductive health among adolescents and young adults with rheumatic and other complex chronic conditions. And finally, Dr. Rebecca Overbury, a rheumatologist with research interests in healthcare transition in adolescent and young adult patients with childhood and adolescent onset rheumatic conditions. And a quick disclaimer, all opinions expressed are the personal perspectives of these individuals, the experts, as well as our young adults who will be sharing on this call, and they're not representative of their institutions. Prior to this event, we conducted a survey amongst members of YP area to better understand what topics and questions young patients with autoimmune diseases wanted to ask their healthcare providers regarding sexual and reproductive health. We used their feedback to generate the following questions that we then asked our experts in pre-recorded interviews. So our first question for our experts was, if a patient wants to have conversations with their disease specialist about sexual and reproductive health care, what are some communication strategies to start these conversations? Here are some of their tips.
Ideally, it is helpful for providers to broach the subject, but I know that that doesn't always happen. But some of my colleagues and I are really working on advocacy efforts to get subspecialty providers to actually bring it up with their patients.
In theory, this is something that any doctor should be bringing up proactively with their patient, I think. But, not surprisingly, there are a lot of things that would fall into that category. So if your doctor doesn't bring it up independently, I wouldn't take that as communication that they don't want to talk about it. It's just that maybe there hasn't been the time or there hasn't been the opportunity for it to be addressed yet.
This is a topic that we're not in subspecialty medicine trained in how to talk about. And so these conversations might feel awkward. And a lot of young people worry that's because, oh my gosh, like I told them something and maybe they're thinking a certain way about that or about me. And frankly, it's just because we don't know how to have those conversations until someone teaches us that, or we start having more of them.
So my assumption is if this is the question being posed, there's probably a specific question that you have or something in particular that you want to talk to your doctor about. In which case, my advice, always, blanket advice, would be to ask. Always ask your doctor. Never feel scared to bring up anything to your disease specialist. They're there to help you and to answer those questions.
I think you can be just pretty frank with your doctor and say, I've heard that chronic disease and medications can interact with reproductive health. What are the things that I need to consider?
But in terms of like how to word it or how to ask the questions, I would say that there is just no right or wrong way.
If there's something that you want to talk to someone about and you're nervous about bringing it up, just saying that up front, saying there's something I want to talk to you about. I have a question. I'm nervous about having this conversation.
It may be helpful if you know that you have questions or concerns before the visit to send a message if you have a patient portal to your provider and say, hey, I have these questions, and if you want to, you could list out some of the questions. And would it be okay if we chatted one-on-one? And most providers are absolutely going to welcome that. For many folks, it can feel most comfortable to talk about sexual and reproductive health in sort of a confidential one-on-one setting. And most providers who take care of adolescent and young adult patients are more than happy to have a one-on-one confidential conversation with their patient. If you bring a parent or a guardian with you, it may be helpful also to mention to your parent, you could say something like, I'm trying to be more independent with my health care. I would like a time to sort of speak privately with my doctor. Would that be okay?
Do not wait until the end of the visit. If there's something that's really important to you and you want to talk about, and you want to try to get as much time from your specialist as you can to discuss that topic, make it clear from the beginning that that's something that you want to address.
And the other thing I think that's important to know is, again, reproductive health is not a big part of our education in subspecialty. And so you might start with us. And I think subspecialists need to be part of the conversation, but you may want more information from someone who specializes in reproductive health. And so it's okay to say, thank you for the information you've given me. Could you refer me to someone else, like adolescent medicine if you're in your teens or early 20s? OBGYN can be really helpful. But starting that conversation can help your doctor figure out how to best support you in putting that team together.
I found that to be really informative. Just thinking about these various strategies and even just the advice of just being frank and open and even expressing like the idea that you're nervous. Um, I think that those are all things that are important for patients to hear sometimes from providers that maybe they don't know everything or they can't read our minds and know what we want to talk about. Um, yeah. So our next question that we posed is, should patients even worry about having these conversations with their disease specialist? And why are these conversations so important? Here's what they had to say.
So it's super, super important to talk to your disease specialist for so many reasons. A lot of our chronic diseases or the medicines people take for them can impact all areas of your reproductive health, whether that's pregnancy, what pregnancy looks like. There's risks related to pregnancy because of disease and that's risk to you, whether related to your disease or, something else like high blood pressure because of your disease. There's risks for your fetus or your baby related to that. There's certain kinds of birth control you may not be able to use because they're less safe for you. You may be at a higher risk of HPV related cancers like genital cancers or throat cancers. So it's really important that your subspecialist is there to highlight those areas that are going to be important for you, and help with screening and things of that nature.
It's so important because having a chronic disease can impact multiple different aspects of sexual and reproductive health. So as an inflammatory bowel disease specialist, I can mostly speak to inflammatory bowel disease, but for inflammatory bowel disease or IBD, IBD can impact the risk of certain side effects of contraceptives or birth control. It can impact pregnancy and fertility. So, and it's likely that your disease specialist is going to understand the link between that disease and reproductive health better than your primary care provider. Although I do love care coordination. So I think the ideal situation is that your reproductive health provider and your primary care provider are having an open dialogue or an open conversation with your disease specialist.
It's also really important because these diseases very commonly affect people and how they feel on a day-to-day basis, whether or not they're in pain, whether or not they're able to sleep well, whether or not they're able to feel like they're meeting their obligations in their life, their work, etc. And these are all things that can affect how you feel about your own sexual health and your own reproductive health and planning.
I again thought that was super useful, but I think we should hear from another council member, Kelsey, about her experiences and thoughts on the video.
Yeah, I know, like, for me personally, it's always hard to, like, talk about, and then you don't know, like, is this something I should be talking about? So I think our experts did a really good job of highlighting the importance of that.
Perfect. So our third question that we asked them are, what resources can patients access before their appointment to guide the conversations with their provider, or after the appointment to supplement the conversations that they had? So we're gonna share some of the resources that they offered. The first being their or your family and friends. Sometimes they can help you identify your needs and preferences and even your beliefs and values and help guide you towards treatment options that might be best aligned with your individual goals. And just knowing that you have that support system is sometimes really valuable. The second are evidence based guidelines, such as the Reproductive Health in Rheumatic Diseases Guidelines or Pre Existing Diabetes and Pregnancy Clinical Practice Guidelines. And sometimes these might be a little bit more challenging to read, but even bringing this to an appointment and walking through it with your provider might be helpful. Next is Planned Parenthood, which offers numerous evidence based resources, as well as the Centers for Young Women's and Young Men's Health, and also Scarletine, which is a less gendered resource. Bedsider also offers a lot of information, especially regarding contraception, if that is what you have most questions about. In addition, one of our experts, Dr. Brenner, runs a research lab which offers amazing resources specifically for patients with inflammatory bowel disease and for their providers. And finally, specific disease organizations and foundations or patient led organizations often share valuable resources regarding sexual and reproductive health, even if that is not their topic that they specialize in. Links to these resources will be included in the post-event email, so please keep an eye for these, and I'm sure they're all very useful. I myself have used Bedsider, and it has been very helpful, but I have taken a peek at some of these others, and they have looked really good. Next question that we asked our experts is, are there any medication or condition contraindications with various birth control methods? And what should patients know about medication and birth control side effects and interactions? Here's what they had to say.
But I think some of the big things that are important and that you may not get when you look online for information are things like risk of blood clots and risk to your bones. And so I'll talk a little bit about that. But I think the biggest thing to think about even before we talk about those specific risks, is what is birth control, and what are the different groups? And so when I, as a doctor, think about them, there's the kind that has both estrogen and progestin in it. So those are the two hormones that are associated with female puberty and reproduction. Ones that have only progestin in it, and then some that are non-hormonal. And a lot of the concern comes up with the ones that have estrogen in it, because that is the kind that can have an increased risk of blood clots. So that could be a blood clot in your arms, your legs, in your brain, like a stroke. And that risk is really, really low for people who don't have anything else. But for our young people with chronic disease, it can be a higher risk just from the disease itself, like people with really bad lupus or people with severe Crohn's disease, for example. And so the best thing that you can do going into some of those conversations is ask your doctor, do I have a higher risk of blood clots than someone else my age? Because that'll be important information for you when you go to the person who will prescribe birth control.
The last thing that I would not be doing my due diligence as a rheumatologist if I didn't mention is that almost all chronic rheumatic diseases also carry an inherent increased risk for blood clots. In particular, systemic lupus erythematosus or antiphospholipid syndrome, and there's some other autoimmune diseases as well. And we know that exogenous estrogen, which is a component of a lot of birth control options, also slightly increases risk of blood clot. So there are particular situations where we pretty emphatically recommend that you avoid birth control that does include exogenous estrogen. It's important to have a conversation with your doctor about what your options are. We are lucky now that we do have a lot of options, and we still have a lot of options. And so having that conversation with your doctor about what makes the most sense for you. Again, nothing is off the table, right? You are allowed to make whatever decision you want for your body, but just knowing what the pros, the cons, the risks, the benefits are so that you can make an informed decision and decide for yourself.
The second piece is bone health. And it's something I don't think we think about a lot, but at this stage in your lives, you're building up the strength in your bones, and that's what you get for the rest of your life. And we know that people who have chronic steroid use, so people who are on prednisone, have lower bone mineral density or bone strength. And we worry about that long term for them. This becomes an issue if you're also wanting to be on Depo-Provera, which is the birth control shot, because while you're on the shot, your bone density also decreases. Now, for normal, everyday, we don't have any other health condition kind of people, that's not concerning because it goes back to an age-appropriate level after you come off of it. But we don't truly know for people who have had chronic steroid use what that might look like. And so I don't use that for people who at least are on steroids at the same time.
Other considerations in inflammatory bowel disease include the risk for impaired bone health with longer term use of the contraceptive injectable, like the Depo-Provera shot, which can sort of add to the already elevated risk for impaired bone health that people living with inflammatory bowel disease have.
That was super informative that all of the providers kind of centered around two main issues, which I myself wasn't really super familiar with. Kelsey, do you have any thoughts on those?
I would say the same thing. Those were the two major risk factors that I was also not aware of prior to these interviews. So I think it's a good thing for everybody to keep in mind as we're making our own decisions about our reproductive health.
Thanks for that. The next question that we asked was, what is the long-term outlook on fertility and disease management? And these are their responses.
So this, I think, is a source of a lot of anxiety for young people, and something we definitely don't talk about enough. So for our diseases in general, they don't have a large impact long-term on fertility. If your disease is not well controlled in that moment, sometimes people can have a harder time getting pregnant. And that's related to, periods. And when your body is stressed, it might not release eggs so that someone could get pregnant, for example. But by no means should you rely on that as birth control, because that almost never works.
Anyone who has a chronic rheumatic disease, it is recommended that any pregnancy be a planned experience. Now, the other thing I always counsel my patients about is that pregnancy is risky business. Even if you don't have a chronic rheumatic disease, you don't take medications, there's always risk involved in a pregnancy. But if we take those steps, if we plan the pregnancy, right? It's something that we plan for, we think about, we know when it's going to happen. If we ensure that we are pursuing pregnancy when your disease is as well controlled as possible, you are at a low disease state, or you are in remission, and we manage your medications such that there's no additional risk to the developing placenta or the baby during that pregnancy, then there's no reason to think that you couldn't have a healthy pregnancy. I think your expectation for doing so would be the same as any other pregnant person.
Yeah, so the outlook is positive overall. It is true that having inflammatory bowel disease can lead to infertility, and that people with inflammatory bowel disease have a higher risk of infertility than those who don't. But most people with inflammatory bowel disease who desire pregnancy have healthy pregnancies. There are some risk factors that can increase risk for having trouble becoming pregnant. And those risk factors include having a pelvic surgery, also waiting to try to become pregnant, and then having active disease. One of the best ways that we can support sort of fertility outcomes and someone being able to become pregnant is by controlling the disease well, is by achieving remission. Oh, and one more point on that is that preliminary data suggests that if someone with inflammatory bowel disease were to have trouble getting pregnant, their likelihood of having a successful pregnancy with assisted reproductive technology, like IVF, that likelihood is just as high as someone who doesn't have inflammatory bowel disease.
We know that people with chronic illness do have fewer children than people who do not, but we think that's more about personal choice rather than having a physiologic reason why they could not have kids. Now, there are some medicines that can influence that, though. And so the one big one that we think about is cyclophosphamide or Cytoxan, which is a medicine we use in people who are really, really sick with lupus or vasculitis, for example. And most of the time at the doses we use in rheumatology, it doesn't cause long-term impacts, but with repeat doses, it could. So I think that's an important piece for people to be talking about with their doctors. And there's a lot of expectations, I think, in the medical field about when people are going to have kids, but that's not always what you all want. And if I've learned anything, you're in charge, like you're driving the ship. I think it's important for you to let people know up front, like, I'm at a point where I'm looking to have kids now, or in the next few years, or like, I never want it. And so like, what are my options there? Because you do have other considerations other people don't, particularly if you do want to have kids. And so, your doctor can help you figure out, is your medicine safe for you to be pregnant on? Is your disease at a good place so that you're having the least amount of risk to both yourself and to a child? And I don't think it's too early to start having those conversations if it's of interest to you, so that you can sort of think through in your mind, what does this look like and how does this fit into my life?
That was super helpful for me to hear. I think like as a young adult, I have so much like on my plate that like sometimes like these more like long-term questions are not really at the front of my mind. And I think just hearing that is really impactful and leaves me with a lot of food for thought. Um, Kelsey, do you have anything to add?
I would echo exactly what you said, Ella. I kind of just like want to like replay it just to hear it all again. because those are such important topics. And I'm glad we're recording this for people to go back and rehear that if they didn't catch the important bits.
Yeah, exactly. And the last question that we asked our experts was, if there's anything else that patients should know, and they had some wonderful things to add.
For people living with inflammatory bowel disease, one of the best way to support healthy pregnancies and increase the odds of being able to become pregnant, if that's what you desire, is to control the disease well. And actually, most of the medicines that we use in inflammatory bowel disease are safe in pregnancy, and it is recommended to continue them. So a lot of the biologic medications like infliximab and adalimumab are safe and recommended to continue during pregnancy. And the other point that I wanted to make, because it affects a lot of my young patients, is that it's not uncommon for people living with IBD who get periods to have cyclical changes in their GI symptoms during their periods and to have significant period cramps. So if that is something that you are experiencing, it's really important to talk with your doctor about it. And sometimes that can be confused with active disease. We have good treatments. Some people start a birth control method to address that. So it's just something to keep in mind and sort of track. If you notice that you're having more diarrhea around the time of your cycle, it may be related to those cyclical changes.
I think one of the big things is Plan B and Ella, emergency contraceptive pills, are not talked about that often, but are really important tools for people who might have some risks if they were to get pregnant. For those who don't know about emergency contraceptive pills, they're pills that you take right after you've had sex that you weren't as protected against pregnancy as you wanted to be. The most important one, a lot of people worry, is this safe for me? Because I'm told a lot of other medicines are not. This is a medicine that you can take no matter what disease you have, no matter what medications you're taking, and it is safe. So anyone can take it. The second piece is this works by delaying ovulation, which is when your body releases an egg. If there's already a pregnancy, it doesn't do anything, which is a reason why it's important to take it as soon as possible. And then it's legal and available in all 50 states. This is another thing that I think people get confused about. For this, time is of the essence. And so though Plan B is approved for up to 3 days following that event and Ella for 5 days, it's really most effective in the first 24 hours or as soon as possible. Because once the egg is released, there's not really anything that it's going to do. And so you can get prescriptions for these. Plan B is also available over the counter, but it's pretty expensive. And Ella is the more effective of the two. So you can talk to your doctor and ask for a prescription before you even need it so that you can have it on hand. And I think the other piece of information that doctors don't know is not only is it more effective, but it's more effective for people of higher weight. So if you're over 165 pounds, Plan B is really less effective for you. And with how much steroid we prescribe in rheumatology, it probably is the better option.
Emphasize again the importance of transparency, openness, candid conversations with your healthcare provider. Don't be scared to ask your questions. If you're not getting satisfactory answers, ask follow-up questions, get a second opinion, right? And then in the context of family planning in particular, working with your doctor so that you can have as positive and as healthy an experience as possible.
I think the other piece that I hear a lot from people is, I went in, I said I was interested in birth control, and they said, great, here is a pill for you to start. But that's not really the best option for everyone. And so I think if you don't get comprehensive counseling from your doctor, it's okay to say, wow, thank you so much for telling me about the pill. What other options do I have? So that you can, continue that conversation. And then finally, there's a lot of talk about what birth control is best for people. And a lot of that is centered around what people find is most effective for preventing pregnancy. But what I want everyone to hear is that the best birth control is the birth control that you feel best taking, not what is necessarily most effective. And so, I encourage you to push for the method that you think really fits best for your life.
That was absolutely great to hear those points, and we will touch back about types of birth control and about how you make those decisions and ways that maybe those decisions can be made easier at the end of the event. So I will jump right in to the next section. We are really thankful, obviously, for for our experts and time they gave to the interviews and their insight. As young adults with autoimmune conditions, we have lots of experience regarding navigating our healthcare, especially surrounding sexual and reproductive health. I'm going to tell a little bit about my story to kick us off. So, living with both juvenile onset rheumatoid arthritis and PCOS taught me how reproductive health and chronic illness can become deeply intertwined, and often in ways that are unexpected and challenging and emotionally complex. At 13, I was diagnosed with juvenile arthritis, and this marked the start of a journey that for me was defined by medication schedules, doctor's appointments, and learning to advocate for myself in every exam room. And a couple years later, when I was around 15 or 16, I received my second diagnosis of polycystic ovarian syndrome. That's when I first kind of realized how much women's health and reproductive health gets complicated by chronic illness. PCOS had its own set of daily struggles. The first solution that my doctors offered me was birth control. Obviously, I understood that if I controlled the PCOS symptoms and I protected against the effects of medication for my arthritis that were potentially harmful if I got pregnant, and I maintained overall reproductive health, that was obviously a win, but the reality wasn't so simple. The birth control for me triggered very intense side effects, a lot to do with mental health, and I questioned if the medication was doing me more harm than good. Research shows that women with PCOS are already at increased risk for depression and anxiety, and hormonal contraception can heighten those risks, especially in adolescents and those with mental health history. And so I found myself stuck between two medical necessities, trying to treat my PCOS and protecting myself from medication related birth defects, all while feeling a little bit mentally unstable. Yet, because I wasn't sexually active, little attention was actually paid to being on a teratogen. Instead, managing my PCOS became more of a balancing act of birth control, lifestyle changes, and ongoing symptom management, always with my side effects as a background concern. And so I really had to talk a lot with my doctors, like why my birth control pills weren't working. And when my symptoms became more severe, my gynecologist actually suggested an IUD, arguing that it would offer better symptom control and effective contraception. And it did not have the same side effects I experienced from oral birth control. But I was kinda anxious. Obviously, it's kind of a big decision to think about contraception and my reproductive health, especially having a chronic condition. And so just the thought of the IUD, the procedure, the physical reminder of my medication history filled me with some dread, and I was worried about pain, the permanence, and loss of control. And so here's kind of where I go back to this idea of shared decision making. My rheumatologist really supported me, but took a step back, trusting my gynecologist to figure things out. I think it was quite empowering and also terrifying to have so much autonomy. But I think I really had a care team that spent time explaining all my options, addressing my concerns, and also validating the anxiety I had with empathy. We talked about strategies, what to expect, and ways to plan for a positive experience, and I felt really heard in those moments. And so eventually, when I agreed to do the IUD, It was only because of several months of conversations and weighing risks and benefits and feeling heard in the room. And this journey really underscored how much women with autoimmune diseases face unique reproductive challenges and decision points. And we have to coordinate between specialists, make sense of complicated risks and benefits, and advocate for our physical and mental health. And so just like a couple takeaways, I think valuing interdisciplinary care, and also having patient-centered shared decision making at the forefront is really important. And so just having everything being fully considered, having some trust and open communication is necessary. My experience makes me want to advocate for others facing similar crossroads and ensuring they know that their voices matter in every room and their decisions are truly their own. So that was a little bit about my experience, and I would like to introduce Kagan, another member of YP area, who will also share her experience.
Hi, everyone. So my name's Kagan Ellis. I am a 21-year-old with ulcerative colitis and an ileostomy bag due to it, and also a member of YP area. So just first off, want to reiterate and just emphasize everything that our experts have said today. There was just so much amazing information that I was just sitting here thinking like, wow, like that's a good point. Like that's really useful. And some of these things that I really wish I had heard about or considered before, like a long time ago. But I just wanted to talk a little bit about my experience and the connection between my chronic illness, inflammatory bowel disease, and my reproductive and sexual health. I just looking back on my experience, I think about really a big absence or rushing of conversations involving sexual and reproductive health due to assumptions. Coming from pediatrics, where that's where most of my time was, and just transitioning, I think that because I was at a children's hospital, there's like a shying away of certain topics, naturally just not bringing them up despite the fact that I was diagnosed at 17 and I'm a teenager and soon to be a young adult. And when I had my surgery, my partial proctocolectomy or my total colectomy, getting my colon removed and my ileostomy bag placed, I remember it being said that, oh, this might have some effects on fertility. And that was it. And then we moved on. And I remember thinking like, oh, I mean, I don't really mind this now, I guess, but that might be important in the future, but we're already here. I'm already about to have the surgery. Okay, I guess. It wasn't something that was talked about prior in preparation, but just like mention, like this might matter in a few years. So I think that it just kind of emphasizes that or draws light to the fact that if I was sick enough to need certain treatments or interventions or surgeries that can impact my reproductive health, then I am old enough to have those conversations earlier and in a more effective way that prepared me and made me more educated on the potential side effects or impacts of certain treatments or surgeries. I think of certain examples, not only just my surgery, but also IBD can impact so many different areas. So uh your pelvic muscles and impacts such as scar tissue and things like that, but I didn't really have those conversations. So in the aftermath of my surgery, just experiencing certain issues with my pelvic floor muscles or learning about the impact that scar tissue after such a major surgery can have, I was like, wow, I wasn't aware of all these different impacts that they could have on my fertility in the future. And as I've gotten older, this has of course mattered to me a lot more. And it just made me wonder if I was old enough for this intervention, then this is definitely information that would be relevant to me in just a few years. So those conversations are certainly important to have then. Um, and then I think that another big thing that I faced in my experience is just providers kind of neglecting the mention of health matters outside of their specialty, despite patients aging throughout specialty care. So that kind of works into what I had said before. But I think that it's important that sexual and reproductive health isn't put on such a big pause when you have, especially patients that are growing into adults. I know for me, I was so sick with my IBD that it was like tunnel vision on it. But I realize more now than ever that my provider, I definitely wish that they had reminded me, like, especially I did have a female provider as well. This is also still important. I think about being on birth control, and I was on birth control before I had even gotten sick. And we never had conversations about the type of birth control I was on, how it may impact my care, my treatments, or maybe switch to this, or how this might affect your IBD, or even having really rough periods in my experience. I knew that it was impacting my disease. I knew that every month I would flare even worse because of my period. And yet those conversations about how my birth control or changes we can make, those really didn't take place. So I was kind of not even aware that they could be taking place and that I could be helped more in that situation through having those conversations and really looking at other options or being referred to someone else who was able to help me with those situations more. And that makes me think about the fact that it took years after I was diagnosed for me to finally get my first pap smear and to even get a mammogram for the first time. And considering how sick I was, those are things that definitely could have been addressed sooner. But I think that providers often can just be so tunnel vision on their own areas that these things are neglected. And I a few years later, or a year after my surgery, I actually had a scan that showed that my uterus had been deviated. And these are things that I didn't even realize were possible, but they're actually extremely common after a surgery like the one that I had. And these are just conversations that are just so important to have with patients. Um, just not neglecting that we are aging. And I didn't just suddenly become a woman after I left pediatrics. I became a woman in pediatrics. So these conversations were very important. But without them and with that tunnel vision, I actually basically my GI ended up being like my only doctor by the time I left pediatrics because we were so tunnel vision. I had aged out of my primary care provider from my childhood, and I hadn't been referred to any other specialist to handle the ongoing issues that we had neglected while solely focusing on my inflammatory bowel disease. So yeah, these are things that when I got outside of pediatrics, when I finally connected to really address my reproductive health, learning that oh, you could change your birth control planning or change your birth control to have periods suppressed or things like this. As a person who was severely anemic, just these different options and things about how your chronic illness can interact with your birth control or your reproductive health and different paths that you can take to manage them both more cohesively. Learning about the different things that could have helped me back then, I just had no idea. And that's because of such major separation of the matters when it's so important for providers to remind you that they are connected. And even if they don't have that education or that information themselves, it's so important that they feel responsible for referring you to someone who can and just that cohesiveness and that collaboration. Because I've definitely learned a lot that would have been very helpful like 4 years ago. So yeah, that's just a little bit about my experience, and just why it's so important for collaboration between providers and remembering that though we are patients, we are still developing, growing, and a lot more information is actually more relevant to us even sooner because of the risk that we take on with certain treatments, interventions, and surgeries. So yeah, thank you.
Thank you so much, Kagan. I think it's really important for people and especially young people to hear like that there are negative things that happen, but there are also like positive things that like happen and just like kind of being informed and really thinking about these issues of like trust and like how do we make these decisions and even get information. Stories like yours highlight why it's important for young patients to be informed and empowered. Next, we are going to hear from Kelsey, who is going to tell us a little bit about decision aids or tools that can help patients making decisions about treatment or even contraception.
Yes, thank you both Ella and Kagan for sharing your guys' stories there. One way that can help you feel more informed, prepared, and empowered when entering a conversation with your doctor is by utilizing a decision aid ahead of your appointment. Using decision aids can help you better understand your options, think through what matters most to you, and prepare for a meaningful conversation with your healthcare provider. My Birth Control is a web-based decision aid that walks you through different birth control methods, sharing accurate and easy to understand information about each one. More specifically, a good decision aid should do each of the following. It should get you thinking about your preferences and priorities. Having identified your preferences and priorities ahead of time, you are better equipped to have a productive conversation with your doctor and participate fully in shared decision making during your appointment. And then next, it should provide accessible and accurate information and make sure you are truly understanding the information that is being shared in this decision aid or any decision aid that you're using. These tools are for your benefit, so you want to make sure you're using them to the maximum effect. A good decision aid should also provide a good way to save your information. Having a copy of any notes or interactive portions emailed or printed is a great way to bring it to your appointment and then further spark that conversation with your doctor. And then lastly, helpful graphics that are easy to navigate and interact with. Just make it easier for you to use. So all of these screenshots that you just saw were taken from the My Birth Control Decision Aid that was created by Dr. Christine Dellendorf and her research team at UCSF. This is a great example of a decision aid that could be useful when considering contraception, as it is free and interactive and takes your preferences into consideration. Additionally, it offers a printable profile and notes to bring to your future appointments and guide conversations with your providers. Check out our social media for upcoming information about this decision aid and Dr. Dellendorf's study. You can also check out our website, youngpatientsarea.org, for more information about Dr. Dellendorf's My Birth Control study, to read blog posts written by our very own Young Patients Area members, such as Climate Change Hits Hard Even on Your Cycle by Nick, or Birth Control is Not One Size Fits All, My Experience with the Rod by Layla, and to find information about decision aids and tools to help you utilize them for your appointments. All of this information will also be included in our post-event email.
Thank you so much, Kelsey, for talking to us about this decision aid. This has been an amazing event. Today, we hoped to shed light on navigating sexual and reproductive health as young people with autoimmune conditions. After hearing from Dr. Erica Brenner, Dr. Brittany Huynh, Dr. Rebecca Overbury, Kagan, and Kelsey, we have learned all about how to start conversations surrounding sexual and reproductive health, why these conversations are so important, and how we can become informed and empowered. Thank you so much for everyone who attended tonight. Thank you so much to our YP area members who helped facilitate this event, and thank you to our experts and speakers. Make sure you check out Young Patients Area Instagram at YP_area and our website at youngpatientsarea.org to access our research guides, informative blog posts, and more information about our members and future events. We ask that you please consider giving us your feedback on this event through the survey link that will be available in the post-event email. This link will also be available in the email that you will receive post-event. Once again, thank you so much for your attendance. If you are interested in staying online after the event to share feedback or even your experiences or ask questions, please feel free to do so, and we will chat with you once the recording has ended. The social opportunity is optional and will not be recorded. Thank you again for attending, and we hope to see you soon.